Hi, my name is Melissa, and the pathogen that I am doing this presentation on is the human papillomavirus, also known as HPV. Sorry, some technical difficulties. Okay, sorry, having some technical difficulties. But yeah, I'm doing the pathogen on the HPV virus. It is a small non-enveloped double-strand DNA virus. It does contain protein capsids. And an interesting distinguishable fact is it is epitheliotrophic, which means it prefers the epithelium. So in other words, it prefers skin. It prefers to live in low oxygen, but it was interesting to find out that when it is exposed to higher levels of oxygen, it can be activated if it was dormant. And also the virus is about 52 to 55 nanometers in diameter. So HPV is worldwide, it's all over the world, it's not prone to just one specific area. And the people who mainly or high-risk individuals would be children, adolescents, young adults between the ages of 15 to 25. There have been more cases in females, but I will talk a little bit more about that why later in the slides, than males. So females have a higher risk or a higher risk individual. Also people who are weakened immune system, immune compromised, they are also a higher risk of catching this virus. The only reservoir for HPV for the virus are humans. So how you can get HPV is transmitted by having vaginal, anal, or oral sex. How I had mentioned before, it is epitheliotrophic, so prefers epithelium, it prefers skin. So portal entry is a skin-to-skin contact. When you are having sex, either be any type of sex, you are close contact with skin, so that is a perfect way for it to be transmitted. Parts of the skin that can be infected are skin of the penis, the vulva, the anus, lining of the vagina, cervix, and rectum. The incubation period for HPV is between 2 to 3 months. Period of illness is a little scary because a lot of people are asymptomatic, so not a lot of people show symptoms, not a lot of people are aware that they are infected with this virus. So sometimes it can take up to 10 years for HPV to be known that they are infected because it is turned into some type of cancer. The contagious period for HPV when you are infected can be 1 to 8 months. So if you are having unprotected sex or any type of skin contact with the person who's infected and you are unaware, between the 1 to 8 months, you will most likely get the HPV virus. Some physical symptoms that you can get from HPV are genital warts or common warts. Genital warts can be in the vagina and the penis. Common warts are in their name common, so like plantar warts, you get some on your face. So just being aware if you are having unprotected sex, be aware if you notice any of these warts and definitely go get them checked out. How I had mentioned here, oh no, was it the previous slide? No, sorry, it was here. That it can take up to 10 years and it can turn into some type of cancer. This is another sign symptom. If you determine if you do have HPV, you can, if you are diagnosed with cervical cancer, but there is only one way to determine if you do have cervical cancer, and that is usually in women. Males don't have cervixes. So when women go get their pap smear done, sometimes abnormal cells pop up. So it is something to go ahead and get further diagnosed to determine if you do have cervical cancer. And that is one indication that you were probably infected with the HPV virus once, and that's what is affecting with the abnormal pap smear results. Complications, especially if you don't get for women, the females, your annually pap smear then it can turn to cervical, vulvar, vaginal cancer. And for males, there are no real ways to determine, I'll talk about it in my next slide, like diagnosis for males. So just getting a yearly checkup, being aware who you're having sex with, getting your regularly STD, STI checks, because HPV does technically fall under the STI, STD category. But again, unfortunately, there is no real test to determine if you have HPV until something pops up like a type of cancer or the warts. So just being aware of that. But for men, high risk complications would be penile, anal, and or throat cancer. Throat cancer can go either male or female. So this is where I'll talk about the diagnosis. Again, I had mentioned any finding abnormal cells, usually abnormal epithelial tissue cells in the cervix is an indication that there may be, or that there was probably HPV virus within a certain time frame. And I was interesting to read that there was also a vinegar solution test, which basically is they'll pour this vinegar solution into a female vagina. And depending if the vinegar has a type of reaction, then that can be an indication that there might be some abnormal cells going on. But again, further diagnostic testing will be needed to be done to be sure. Prevention for HPV is practicing safe sex, since again, it is under the STD, STI category, and there is no real way to determine, or no real test like testing for chlamydia or gonorrhea. You just have to practice safe sex and getting vaccinated. They do have these vaccines for children to get them boosted when they're young. You can get them boosted, or you can get the vaccine if you didn't get it when you were a child. So just being up to date with your vaccinations. Treatment, there is no real treatment just because it is a virus. Most children, young adults, the virus will go away in a sense, like it'll just, and for lack of better words, go away. Things will go back to normal because your immune system will hopefully help fight it off. The salicylic acid for warts, if you do have any genital warts or the common warts. And lastly, surgical removal of any cancer. So if you do, like I said, for the women and the females, if they do get a pap smear and something does come back abnormal, and it is determined that there is some type of cervical vaginal cancer, then surgically removing those cancerous cells to prevent the spreading of more. And same thing for males if any type of cancer pops up. And these were my resources.